Good afternoon, everyone. Thanks for taking time out of your day to watch and listen to the AHK 2017 Open Enrollment presentation. My name is Julie Martin. I'm from Assured Partners NL. We are your insurance broker. We work with Brenda Collins and her team at corporate to help bring you a comprehensive benefits package. The good news is there are no changes to your plans, no changes to your carriers, and there is a slight increase to the rates, but everything else has remained exactly the same. So the changes are minimal for this year. So let's jump right in to the medical plan. Those benefits are going to continue to be administered by Anthem. You have that PPO plan and the HSA plan. So on the PPO, it's a $1,000 deductible for single, $2,000 for family. That out-of-pocket, which includes the deductible, $4,000 and $8,000. Anything that's subject to the deductible, you'll satisfy that deductible and then you'll pay the 20% co-insurance until you reach that $4,000 out-of-pocket. You have co-payments for your office visits, so $25 for a primary care, $40 for a specialist. Next up is the emergency room. We want you to use the emergency room in the event of an emergency only. If you feel you're going to lose life or limb, please go to the ER, but if you have a scratchy throat or runny nose, you may want to utilize an avenue like an urgent care center or your primary care doctor. The emergency room is very expensive for you. It's a $250 copayment plus 20% coinsurance. It's also very expensive for the plan. Your average emergency room visit runs around $1,500. I always tell folks, if you have chest pain or your bone is sticking out of your arm, go to the ER. Anything else, primary care or urgent care. This plan also has prescription drug co-payments, and your drugs are put into 4 different tiers. So Tier 1 drugs are $15, Tier 2, $35, Tier 3 is $55, Tier 4 is a 25% co-payment with a max of $150 per prescription. Just a note about your co-payments and your out-of-pocket limit. It used to be that co-payments just your part of the service. Co-payments now accumulate toward that out-of-pocket limit, so the $4,000 is a true out-of-pocket limit. Up next is the HSA plan, so it's a $2,600 deductible for single, $5,200 for the family. The out-of-pocket, which includes that deductible, $3,500 for single, $7,000 for family. After you have satisfied that deductible, all of your medical services are going to pay at 100%, and that additional $900 is going to be made up of prescription drug co-payments. So $10 for Tier 1, $50 for Tier 2, $75 for Tier 3, and that same 25% co-payment for Tier 4. Preventive care on both of these plans is covered at 100%, so things like immunization, so flu shots, shingles vaccinations, pneumonia shots, those are all covered. Well woman checkups, so pap smears, mammograms, any well child checkups, including childhood immunizations, routine physicals with blood pressure tests, cholesterol tests, colonoscopies for colorectal cancer screenings are also covered at 100%. If you're healthy, we want you to remain healthy, and if you do develop some type of condition, we want to catch that in the earliest possible phase. That's going to lessen your cost, that's going to lessen the plan's cost, and it's going to improve your outcome overall. Just some helpful hints about your plan. You're on a calendar year deductible, so that runs from January 1st through December 31st. Any amounts that you meet through February 28th will be carried forward to the new plan you select that goes into effect on March 1st. So say you're on the PPO plan and you want to move over to the HSA, anything that you've met towards your deductible and your out-of-pocket are going to be carried forward to that new plan. You will not have to start over until your new deductible year begins on January 1st, 2018. And just a reminder that only those making changes will receive new ID cards. So if you're keeping everything exactly the same, continue to use that same Anthem card that you have in your wallet. We're going to talk a little bit about health savings accounts, or HSAs, and you have the opportunity to make contributions to a health savings account, but you must be enrolled in the high deductible health plan. An HSA is an account owned by an employee used to pay for current and future medical expenses. There's no use it or lose it rule like a flexible spending account. All amounts in the HSA are fully vested, so you don't have to wait for a particular amount of years for those funds to be fully vested. So $50 is $50 today, tomorrow, and next year. Unspent balances in your account remain in the account until they're spent, so it's just going to roll over from year to year. So say you put $1,000 in your HSA and you have a really good year health-wise, that money is just going to carry forward. You're not going to lose it. The account belongs to you, the employee, so if you ever leave employment, AHK, those funds go with you. And it encourages you to shop around for the best value for your health care dollar. Who's eligible for an HSA? You have to be covered by a high deductible health plan, so you can't be enrolled in that PPO option. You can't be covered by another health insurance. You can't be enrolled in Medicare, and you can't be claimed as a dependent on someone else's tax return. This next slide talks about HSA distributions. Should the HSA account holder keep receipts? And the answer to that is a big bold red yes. You may need to prove to the IRS that the distributions from your HSA were for medical expenses. You might be required to prove that your deductible was met. And not all expenses paid out of the HSA are charged against your deductible. So if you use your HSA for dental or vision, those services wouldn't apply to that medical deductible. I have a pretty low-tech system when it comes to keeping up with distributions from my HSA account. I have a big manila envelope with a metal clasp. Each year I have one at the office, I have one at home. It says 2017 HSA. Each time I use my HSA account to pay a doctor bill or pick up a prescription, that receipt goes in the envelope. At the end of the year, that envelope is closed. I attach it to my tax return. So in the event that the IRS asks me, Ms. Martin, this $2,500 for HSA distributions, can you prove those were for qualified medical expenses? I can hand him that envelope and say, yes, Mr. Taxman, I can. If you're unable to provide that type of documentation, the IRS will tax that money as income and slap you with a 20% penalty. So make sure you have a system. Some folks tell me that they keep a shoebox under their bed. I have others that scan them into their computer. Just pick a system and stick with it so you have access to that information should the need arise for it. Because these accounts are given tax advantage status by the IRS, there are some limits on how much you can contribute. There are no caps on how high the balance in your account can be. So for 2017, it's $3,400 for a single, $6,750 for a family. If you're older than age 55, you can put an additional $1,000 catch-up contribution. For those employees that elect the Health Savings Account Medical Plan option, AHK will be contributing $500 for single coverage and $1,000 for all other tiers. And the $3,400 limit for single is a combination of employer and employee contributions. So if you would like to max out that account, you would just be putting $2,400 of your own money in the account. Up next is dental. You're remaining with Anthem Dental, and you're on the Dental Complete product. The deductible on this plan is $50 for single coverage, $150 for family. Your annual plan maximum, the plan pays out $1,500 per member per year. There are no waiting periods. Your preventive services, so things like routine cleanings, those bite wing x-rays, they're covered at 100% and the deductible does not apply. Your basic services, things like routine fillings, simple extractions, those are subject to the deductible and then covered at 80%. Type 3 services, inlays, onlays, crowns, prosthodontics, implants, endodontics, periodontics, those are subject to the deductible and then covered at 50%. There's also an orthodontia benefit available for children under age 19. It's a 50% benefit and it's a $1,000 lifetime maximum. Just a reminder that non-participating dentists may balance bill, and what's balance billing is the difference between the allowed amount and the billed amount. So when doctors and dentists agree to be in the Anthem network, they agree to a reduced fee schedule as payment in full for their services. Non-network dentists don't have that same agreement. So if they bill $100 for a filling and Anthem only reimburses $50, you may receive a bill for that additional $50, the balance between the billed amount and the allowed. If you have a question about who is in network, you can go online to anthem.com and look up your dentist in the Dental Complete network. You also have vision through Anthem. You can get an exam every 12 months for a $20 copay. There is a retinal imaging benefit that's available on the plan, and what this allows is your doctor to take a picture of your retina, and they can see the exact same thing in this picture that they can see when they use the dilation drops on your eyes. I don't know about you, but I don't like to have my eyes dilated, and I think it's well worth the $39 to have the picture taken. For those of you who are contact lens wearers, you know that you have to pay a contact lens fitting fee. The plan caps that at $55. You can get frames every 24 months. There's a $20 copay for the frames, and you get $130 allowance plus 20% off that balance over $130. So say you go in, you find the perfect pair of frames, but they're $200. Anthem is going to give you $130 toward those frames and then 20% off that remaining $70 balance. You can get lenses for your glasses every 12 months for a $20 copay, and those are single vision plastic lined bifocal or lined trifocal lenses. If you like the no line look, those are considered progressive lenses. There's a standard progressive lens benefit with a $65 copay. There's also a premium progressive lens benefit. So tier 1 would be an $85 copay, tier 2 is $95, tier 3 is $110. There are several different types of progressive lenses, and the thing that's nice about vision is that your provider has instant access to your vision benefits as well as the real-time pricing. So if you want to know if your progressive lens falls into standard or premium, your provider can tell you that while you're actually there at the eye doctor. So that's nice. Or you can choose to use your vision benefit for contacts. I wear my contacts every day, so I use my vision benefit for contacts. So you can get glasses or contacts, but not both. If you choose to do that, you get a $130 allowance, but it's a once per year benefit. So I encourage you to get at least $130 worth of contacts at once. That way you know you've exhausted that allowance and you don't have to make trips back and forth to the eye doctor. There's also an additional pairs benefit. So if you break the only pair of glasses that work for you and you've already used your vision benefit for the year, you can receive a 40% discount off a complete pair of eyeglasses. Children under age 19 receive free transitions, free polycarbonate lenses, and free scratch coating. For adults, these are buy-ups, but if you have kiddos and glasses, you will not pay for those upgrades, so that's nice. Here's your benefits package pricing. These are your biweekly payroll deductions. So for the PPO plan, for employee only, it's $49.49. For employee and spouse, $190.50. For employee and children, $95.02. For family coverage, $159.28. On the HSA plan, that's no cost for the employee, $97.34 for employee and spouse, $63.81 for employee and children, and $106.90 for family coverage. Just a reminder that employees that elect the health savings account option, AHK will be contributing $500 for single coverage and $1,000 for all other tiers. This contribution will be prorated and put in biweekly throughout the year. You're also provided a $40,000 basic life and AD&D policy at no cost to you. That benefit is provided by Anthem. You also have the opportunity to purchase additional voluntary life and AD&D through One America. If you're a new hire, there's a guaranteed issue limit of $150,000 for yourself, $50,000 for your spouse, and $10,000 for your dependent children. If you're currently participating in the voluntary life, you can increase your coverage amount by 10%, or $10,000, with no questions asked. You can elect coverage for yourself, your spouse, or your children. You must elect coverage on yourself if you want to get coverage for a spouse or a dependent child. And their coverage amount can't be more than 50% of yours. So if you want to have $10,000 on your child, you need to have at least $20,000 on yourself. If you have waived voluntary life coverage in the past and you want to elect it this year, you will need to fill out an evidence of insurability form. That will ask you some medical questions, and then One America will review the answer to those questions to see if they can issue coverage. Up next is voluntary short-term disability. We refer to this as paycheck insurance. So it helps protect your income if you're unable to work due to a covered accident or a covered illness. Pays you 60% of your weekly income to a maximum of $1,000 per week. Benefits begin after 14 days, and that's 14 calendar days, not 14 working days. It covers maternity, and there is a 24-week maximum benefit period. So say you're battling an illness, you've been off for 24 weeks, and your doctor doesn't feel that you're ready to come back to work yet. That's when voluntary long-term disability is going to kick in. It's going to pay you 60% of your monthly income, up to $5,000 per month. It's a 180-day elimination period, so it picks up when that short-term disability ends, and it lasts, or your benefit duration, to your Social Security normal retirement age, which could be 66, 67, 68, just depends on your date of birth. There's also return to work assistance available through these plans. You also have some products available through AFLAC. These are supplemental plans that pay you directly. There is accident insurance, so it pays you specific sums related to your injury. So it can pay you a different amount for a cut, repair with stitches due to a broken leg. Whatever those are. There's also hospitalization and hospital confinement benefit, and those are paid directly to you. You also have a lump sum critical illness benefit available. You can choose either $10,000 or $20,000, and it pays a lump sum directly to you upon diagnosis of a covered critical illness. So things like cancer, coma, end-stage renal disease, heart attack, organ transplant, paralysis, or stroke. There are no deductibles, no co-payments or network restrictions. You choose your own medical treatment provider, and these funds are paid directly to you. So you can use them to pay your medical bills, you can use them to buy groceries. The choice is yours. If you are interested in enrolling in AFLAC coverage, please let Human Resources know, and they can connect you with an AFLAC representative that can get you enrolled. Just a reminder that you must keep your elections in place for the entire plan year, which runs March 1st through February 28th, unless you have a qualified status change, or what we refer to as a qualifying event, which could include a marriage or divorce, a birth or adoption of a child, becoming newly eligible for Medicare, or a change in your dependent's employment that affects his or her benefits. You have 30 days to get these changes made. If you wait longer than 30 days, you will have to wait till next year's open enrollment. So if any of these things happen to you, please go to Human Resources within those 30 days and get those changes made. Here are your next steps. Discuss the benefit options with your family. Everyone is going to need to submit an enrollment form to Human Resources, even if you're not making any changes. All forms are due to HR by February 3rd. Those enrolling in the HSA for the first time, or those that wish to change their health savings account contribution, need to complete an HSA election form. Even if you are not contributing any additional funds to the HSA, we will need to get that HSA bank account open for you so AHK can make their contributions on your behalf. Those who currently enrolled in the voluntary life wishing to increase their benefit by $10,000 need to complete the GIB form. You can get your personalized GIB form from Human Resources. You will see what your current amount is, what you're paying for that, and then you will see what your increased amount is and your new payroll deduction. Those enrolling in voluntary life or disability coverage for the first time that are not new hires need to complete an evidence of insurability form. And just a reminder that open enrollment is a great time to update your beneficiary information. If you've had a life change this year and you would like to change your basic life or voluntary life beneficiary information, please see Human Resources for a change form. All too often we see that people don't update their beneficiaries, and then the funds go to someone who's no longer in that employee's life. So please make sure to update your beneficiaries. I want to thank you so much for taking time out of your day to listen to this open enrollment presentation. Should you have any questions, feel free to reach out to Human Resources and we will get those questions answered for you. Thanks and have a great day.